What do we want? Now. What do we want?
Justice.
What do we want?
Now.
What do we want?
Justice.
What do we want?
Now.
A group of 20 protesters gathered this morning in front of Sentara RMH Medical Center to protest the hospital's visitation policy, which prohibits visitors for patients who have been confirmed or are suspected of having COVID-19. Protesters chanted and held signs.
What?
Justice.
When do we want it?
Now.
What do we want?
Justice.
When do we want it?
Now.
Patient rights are human rights.
Patient rights are human rights.
Patient rights are human rights.
Patient rights are
Rally organizer Mike Donovan, who is the president and CEO of Nexus Services, said he organized the protest after a woman that attends his church, Camilla Bruce, told him that her mother was admitted to RMH with COVID-19 and that she would not be allowed to have visitors and was being held against her will.
One of the members of our church community, her mother was diagnosed with COVID-19 and pneumonia, admitted to the hospital, and she was supposed to be released on Sunday. And that was the anticipation. However, the hospital felt that she wasn't doing well enough to be released. The family, who hadn't been able to see her, said, look, we want to see her. We want to make sure she can come home. She's scared. She thinks she's coming home today. And the hospital's answer was, sorry, these are the new rules. You can't see your mother. She can't come home. And then when the mother tried to leave on Sunday, the hospital forced her to take sedatives, and now she is sedated in this hospital, held against her will, without explanation to the family of what's going on. And just because we're in the middle of a pandemic and a public health crisis doesn't mean that hospitals can ignore patient rights, can ignore family rights, and there's no reason why in this country we have to sacrifice being able to live and die with dignity, which is an absolute right that we all should have and at least aspire to. And if I'm sick, I want my family with me. If my family's sick, I want to be with them. And the reality in Harrisonburg and across the country right now is that if you go to the hospital and you get COVID-19, you'll never see your family again. If you are unfortunate enough to not recover, they'll never see you again. They'll watch you die through a glass. And the family in this case was told by the hospital that they'll get a call when she's passing, and two of them can come and watch her die through a piece of glass. This is the United States of America. We're better than this.
Bruce, seen here with her daughter, Tiffany Jackson, said her mother tried to leave the hospital this past Sunday to go home and quarantine, but that the hospital is holding her against her will without a court-ordered temporary detention order.
She was happy. She wanted to come out of there. She said she felt fine, and they told her she couldn't leave. So she went into, got upset, very upset, and I feel like she was fighting them, like, trying to pull out her IVs because she wanted to go home, and they wouldn't let her. So they sedated her with medicine. And they tried to say my mom was delirious, but absolutely my mom had a sound mind when she was there at that point.
Mike Donovan says that is a violation of the patient's rights.
If you are dying alone, and you have family on the other side of a glass that they can't see you, if that family is willing to quarantine and use the proper precautions, who are we to say that that person has to die alone? And who are we to say that that family member doesn't have a right to be with their loved one? It is wrong. It's unconscionable what's happening. And our hospitals have veritably turned into COVID-19 detention facilities. And every hospital has, not all of those patients want to leave, but those that do want to leave can't. And that's an important thing that we need to start talking about in this country. The hospital says we are not aware of anyone who wants to leave. But when you sedate them when they ask, then you're not going to be aware. And there's a function in this state called a TDO, a temporary detention order, and that you get from a magistrate. This hospital did not get that. They force sedated a woman who wanted to leave. They've kept her here force sedated, and they have yet to receive a TDO for her arrest. This is unconscionable. It's a violation of her constitutional rights. It's a violation of her family's rights, and we're going to be here protesting. We're filing litigation. I'm funding litigation against the hospital. I don't want to do that in the middle of a public health crisis, but I don't have a choice, because families have a right to be together, and people have a right to live and die with dignity.
Ms. Bruce said Sentara RMH staff told her that she will never see her mother again.
They said we'd never see my mom again unless she was dying, and I might be able to get to look through the window, the plastic window that would divide me and her. And that would have to be approved by the administration, and that would take time.
Do you remember who told you that?
Yes, the palliative care lady, Jean Walters.
The people united will never be defeated. The people united will never be defeated.
I'm here for my mother. I'm here for my family. I am here for everyone who has suffered through what we're going through right now. I never thought that it would hit us. I never thought we'd be here, but I'm glad I'm here. I'm glad my daughter's here, my mom's granddaughter. I'm glad we're here to make a voice for other people who have not been able to do that or who thinks they don't have any rights. I'm just proud of everybody that's here today to stand along with us, to fight for other people also who is going through this, because we should be with our families when this is going on.
In Harrisonburg, Theodore Whitelow, Breaking Through News.